Good evening, everyone. My name is Dr. J Lakhani. I'm a consultant endocrinologist at Zydus Hospital in Ahmedabad. And today I'm going to talk to you about insulin algorithm. First and foremost, let me thank the organizers for having me for this meeting. And I would like to start by sharing my screen. So this is a very important and unique topic, and we are going to discuss uh, the nuances of an insulin algorithm. The idea is to basically implant some ideas in your brain, which I hope would be useful in your clinical practice as well as in your academic research. So I believe a lot in the concept of computational medicine. And what I very strongly believe is that precision in medical care is what is required and what is lacking in a lot of our clinical practice. So clinical practice can be divided into two parts. One is the science part of it, other is the mathematics part of it. There's also an art to it, which is the third layer to it. Now, the scientific part is what you get from the research and what you get from the clinical, the articles and the research which have been done. But the mathematics part of it is to how to apply that research and the clinical knowledge we have to precisely treat your patients. Then, of course, there's the art part of it where you are able to deliver this same thing to your patients in terms of the empathy and the clinical care which is required. So today we are not going to talk about the science, or we are not going to talk about the art of it, but we are going to talk about the mathematics of it, and that is the computational medicine. So what exactly is an algorithm, or what's a formula or a function? Now, an algorithm has three parts. One, you have the input, then you have the algorithm, right, which processes the input and then gives an output, right? So basically, this is what an algorithm is. So any algorithm, whether it is related to insulin or otherwise, this is the flow chart which will be followed. Now, what would be an algorithm for insulin, right? So if you want to make an algorithm for insulin, you'll require, like we discussed, you'll require some inputs, you'll require inputs, and then you will have the algorithm, and then you'll get an output, right? So first, let's look at what inputs would be required. So what are the inputs which go into making an insulin algorithm? So of course, you'll require the current glucose value, and you'll require some food and carbohydrate intake which the patient is eating. These are very basic. These are absolutely necessary. Then you will require some advanced variables. For example, the age of the patient, the HbA1c of the patient, the renal function of the patients. There could be any medications, for example, steroids, which could impact glucose values, whether the patient is having glucotoxicity or not, whether there's an underlying infection or not. What is the historical glucose values of the patient? These are all advanced variables which you can add to the algorithm. The algorithm should be able to answer these questions. Which insulin to give? How much of insulin to give, which route to give, should I give it IV, should I give it subcutaneous, etc., and how long to give. So these are all answers which you should be able to get at the end of any ideal insulin algorithm. What is the output? Type of insulin, dose of insulin, route, and duration, right? So these are the output we should be able to get from an insulin algorithm. Now, an insulin algorithm also, just like anything in endocrinology, should require a feedback loop, right? Feedback is the most important thing. I think it is very, very important for human beings in general, not just in terms of clinical practice, right? In clinical practice also, we learn from feedback. For example, you prescribe a drug to the patient, the drug had side effects to the drug, in that patient, so you are next time careful in prescribing such a drug to the patient, right? So there is a feedback loop, right? Anything which works and improves has a feedback loop, and if there is no feedback loop, there is no improvement. That is very important and essential. So for the insulin loop as well, will require a feedback loop. So you'll have the input variable, you will have the algorithm, then you have the output parameters, then the clinical impact, and then clinical impact feeds back into the insulin algorithm, right? So this is the feedback loop which should be completed. Whether I gave the right amount of insulin, whether I give less amount of insulin, whether I give more amount of insulin, leading to hypoglycemia, all these things should get feedback into the insulin algorithm so that the algorithm improves, right? The process of this doing continuously is what is known as machine learning, right? So machine learning basically is a process where you have this continuous feedback loop which keeps happening in a more advanced manner so that the algorithm keeps improving for the patient. Now, we have in our own body an inbuilt natural algorithm, right? The entire system, why insulin is ideal for an algorithmic system is because we have a natural algorithm inbuilt into the system. So you eat food, the blood glucose level increase, right? As a result, the beta cell have glucose receptor. So it senses the glucose, right? It senses the glucose and produces insulin as per the set point, right? What does the insulin do? It increases the glucose uptake in the fat and muscles, and some extra glucose is then stored as glycogen, right? And then this reduces the blood glucose, and you can see the feedback loop over here. The blood glucose level come down, and hence the insulin production comes down. So this is the natural algorithm which is there in the human body, and this algorithm is what we need to replicate whenever we make any insulin algorithm. Okay, so where do we use algorithms currently, right? Now, currently, there is only one application, one place where we use the algorithm. But once at the end of this lecture, you'll realize that we also use algorithms in other places as well. But in a commercial sense, we use it in insulin pumps. You could use algorithms in insulin infusions in ICUs. We'll talk about this. And in future, you can use this in non-ICU and outpatient setting also. And that is what we are trying to develop in the future. So let's look at the insulin pumps. Now, insulin algorithms are essential parts of insulin pumps, especially the advanced insulin pumps, which are also known as hybrid closed loop devices. Let's dwell into this topic in a little bit more detail. Now, what's an ideal model for algorithm for an insulin pump, right? Now, we already saw that what the natural system requires is two things. One, you should be able to sense the glucose value, right? So you need to sense the glucose value, and then you need to deliver the insulin, right? So these two parts should be essential of the insulin algorithm, which is built into the insulin pump, right? So what the insulin pump does is it has a glucose level. It checks through a glucose sensor, generally a CGM. Then there is a modulation control algorithm, and then it delivers the insulin via the pump. So this is the entire system. That's why it's also known as an artificial pancreas system, because it is able to do exactly things which the pancreas is able to do, right? So this is the model for an insulin pump. Any insulin pump which has an algorithm built in, this is the model which they use. Now, there are three existing models for insulin pump. What is known as, first is known as proportional integrative differential model, or the PID algorithm. PID algorithm is part of the Medtronic 670G insulin pump. Then you have the model predictive controller algorithm, which is part of Medtronic 780G and the T-Slim pump, which is not available in India. And then you have the next generation algorithm, which are known as fuzzy logic, which we'll discuss, which is called the MD-Lab algorithm as well. Okay, so let's discuss the concept of these models so that you understand how your pumps really work. Now, the most basic algorithm is the proportional integrative differential model. Now, you don't need to understand what basically it is, but what it tells us is that you have a set point, right? You want the blood glucose to reach a particular set point. Most of the time, they set the level as 120 milligram per deciliter, right? So this is the level which you want to reach, right? So you have a set point. You use a proportional integrative differential to deliver what is known as microboluses. Okay, so just to put it in simple words, you deliver what is known as a microbolus, right? So microbolus is very small amount of insulin that you deliver into the system. Okay, so for example, your set point is 120, okay, and your current glucose is 220. So what the system does is it gives small boluses to achieve the blood glucose level of 120, right? So this is, in quite simple terms, this is what is a microbolus, and this is what is a PID model, right? A proportional integrative differential model, right? This is based on your calculus. But then you have a more advanced model, right, which is the MPC model, which is now used in the advanced pumps. Some of them are available in India. So this is a predictive model, right? So what you had in this PID model is not a predictive model. PID model is a model which tells you at this point of time the blood glucose is this much and it should be this much, right? It was supposed to be 120, but it is 220. So let's bring it down to 120. That is what it is. But what the MPC model does is it anticipates the future, and it sees that in future where the glucose is going towards. So for example, if your blood glucose currently is 140, but your blood glucose is rising and you want your blood glucose to come to 120, it will still deliver the bolus. On the other hand, if your blood glucose is 220, but it is already falling, then it will deliver less amount of insulin, or probably it will give smaller microboluses, right? So that is what is basically the MPC model, where it predicts the future and forecasts the glucose level into the future and delivers accordingly, right? So this is much more effective because of the forecasting ability. You are able to get a less amount of hypoglycemias and less amount of complications because of the insulin dosing. Then you have the fuzzy logic models, and this is a very important concept to understand, right? Now, there are two types of logic which are there in general, right? One is the binary logic, and the other is fuzzy logic. Now let's first understand binary logic. And binary logic is essential in any computer system, right? Most computers understand binary logic. Binary logic is 0 or 1. It is either on or off. It is only two variables. Either it is yes or no, on, off, male, female. You just have two. That is binary, right? So binary is basically two logic. Now, for example, when I write a code for let's say I write a program in Python, right? So in the program I say that if the temperature is greater than 40 degrees Celsius, you call it hot, right? And if it is temperature is less than equal to 40 degrees Celsius, then called it cold. Okay, so this is binary, right? So more than 40 degrees is hot and less than equal to 40 degrees is cold, for example, right? This is just an example, right? Obviously 40 degrees is not cold, but this is an example, right? Now if the temperature, so I say that if the the temperature is hot, then start AC, and if the temperature is cold, stop AC, right? So this is a simple algorithm which I made. Now if the temperature is right now 40.5 degrees, it will start the air conditioner. Temperature comes down to 39.5 degrees, it will stop the air conditioner, right? Simple binary logic. But in reality, it is not like that, right? Sometimes some people may feel hot at 39.5 also, right? Some people may feel hot at 38 degrees also. They want the AC to be on at 38 degrees also. So some, you don't use terms hot and cold. We say we feel warm, sometimes we feel cold, it is little cold, it is little hot. So this type of logic, which is not binary, is fuzzy logic, right? This is what is fuzzy logic. And hence, now the next generation thing is that since you're dealing with human beings, you're not dealing with computers, you are likely to achieve fuzzy logic, which is more effective than compared to binary logic. So in binary logic, it is simple, right? If glucose level is high, deliver insulin, right? This is the simple binary logic. This is binary logic. But what is fuzzy logic? Fuzzy logic is more complex. For example, if the glucose level is high and the patient is exercising, do not deliver insulin. That is fuzzy logic, right? So that is where now you have the next generation algorithm, which also looks at these kind of settings. These are still not available in India, but they'll be available soon. And eventually you'll be all using fuzzy logic algorithms, which are more complex, which use artificial intelligence also and machine learning to understand the nuances of the entire picture so that it is able to deliver the right amount of insulin. Okay, let's look at it further. Okay, now let's look at insulin algorithms in ICU. Right, so in ICU, we all have used algorithm. Now, there are many algorithms available, and the one which is quite popular is the Yale protocol. I'm not going to go into too much detail about what the protocol is and other things, but just to kind of simplify, we are actually making an app also. There used to be an app available for this, but unfortunately it's not available anymore. So we'll be making an app in future about the Yale protocol in ICU, right? So in Yale protocol, what you do is, you can see here, there are two tables, right? So basically it is an IV insulin algorithm, right? So it's for IV insulin, right? So what you do is you use 50 units of regular human insulin in 50 ml of normal saline, and you give it with a infusion pump, right? So that is the basics of starting a Yale protocol. Now here you have to look at two things. You have to look at the current glucose value, and you also have to look at the change in the glucose value. So for example, if the patient's current glucose is 220, let's say the patient started with glucose of 300, and then you started the insulin infusion, and now after 1 hour the patient's glucose is 220, right? So you have to look at this column, right? Blood glucose is more than 200, but you also have to look at the change in the glucose value, right? So the glucose fell by 80 milligram per deciliter in 1 hour, right? So you look at this column, right? So the glucose fall was 80 milligram per deciliter in 1 hour. So in that case, you have to reduce the infusion rate by the set parameter, which is delta, and delta you can see here is the change in the infusion rate, right? So you need to change so if the current infusion, let's say you started with the current infusion of 3, right? Let's say 3.1 for example, then you need to reduce the thing by delta, that is 1 unit per hour, right? So if you're giving at 3 ml per hour of infusion, then you reduce the infusion rate to 2 ml per hour, right? You understand the basics of it, right? So this is what basically is a Yale protocol, which is again a form of algorithm where you are using for IV insulin, right? So this is a very refined protocol for management in ICU setting. Then of course you can use insulin algorithms in non-ICU setting also. In fact, the simplest is sliding scale insulin, a lot of people use, but this is a bad idea, right? Remember, sliding scale insulin actually does more harm to the body than any benefit. So it is a reactive thing, just like you saw in case of the proportional integrative model. This is in fact something like this. This is so PID is not a bad thing because you're giving micro boluses, but here you're actually giving large boluses. Hence, you are actually creating more problem, and hence the sliding scale insulin is actually a bad idea. You can see some of my other videos on this topic to dwell more into it, right? So generally should not consider using sliding scale. What you need to do is you need to have a more effective algorithm in a setting, in a hospital setting, right? Again, we are developing some systems for that. I have a separate lecture for this, maybe for management of non-critical ill patients in IC in you know non-ICU setting. So we can discuss that in more detail in terms of the algorithm there. Let's discuss insulin algorithms in outpatient setting, right? So in OPD setting, again, you have to consider a few things, right? So in OPD setting, you need to see one, do I need insulin? Does the patient need insulin, right? Does the patient need insulin? That is one's first question, right? Then which insulin? Okay, so let's say you have a patient with type 2. Which insulin would you give? Would you give this patient premix insulin? Would you give this patient basal insulin? Would you give basal bolus insulin? Right? What dose to start? How to titrate? Right? All these things should be part of the algorithm, right? So there are no set algorithms, but like I said, we are developing some of these things, right? So one formula you can use, for example, to answer the question whether the patient requires a premix or basal insulin. So use this formula, that is fasting blood glucose divided by HbA1c, right? So if it's less than 20, you should consider giving premix insulin. If it's more than equal to 20, you should consider giving basal insulin. For example, if the fasting glucose is 220, for example, and HbA1c is 10, then the value comes to 22, right? So in such cases, you would give this patient a basal insulin, right? So that is the formula for calculating the what type of insulin to give, right? The logic for the formula is that if the ratio is higher, means there is higher contribution of fasting glucose to HbA1c, and hence basal insulin would be a good idea. However, if the ratio is lower, for example, if the fasting glucose is 140 and post meal is 280, right, and HbA1c is 10, that means a lot of contribution is coming from the post meal sugar, right? So in that case, you need to give a premix insulin to get the better result. Then of course, how much, let's say for example, you decided to give basal insulin. So how much basal insulin to give again can be set by various formulas. So you could have a weight based formula. For example, basal insulin dose is weight into 0.2, right? So this is a weight based algorithm which you can use, but alternatively you can use the Hallman and Turner formula, which is based on the fasting glucose, that is fasting plasma glucose minus 50 divided by 10. For example, let's say your patient's fasting sugar is 250, so you do 250 minus 50 divided by 10, that will give you 20 units of insulin, right? So you start with 20 units of insulin based on the Hallman and Turner formula. Again, how much bolus insulin to give, right? So sometimes you do basal plus therapy. So bolus insulin you can also calculate using a formula called post meal glucose divided by 36, right? For example, again, let's say your post meal sugar is 360, right? So divide by 36, so you give 10 units of insulin before the meal, right? So that is something you can use for a bolus for the calculation of bolus, right? So these are some examples. We have made a complete separate video on mathematics of insulin dosing, which you can have a look, which will tell you about the entire picture of how in type 1 diabetes, in type 2, in hospitalized patient, etc. But just to give you a glimpse of, these are the things which are can be made into an algorithm, right? Now we actually did this. We actually made the algorithm. We used to have an app which is now discontinued for cost reasons, but the app was called Centurion Insulin app, which was basically made for doctors to consider all these parameters, right? Whether a patient with type 2 should be started on insulin, which insulin to give, what dose to give, and so on, right? But because of cost reasons, we discontinued it. It was a free app, and we actually lost a lot of money because of that. Having said that, we plan to kind of do this in future as well in a more refined manner. But having said that, anybody interested who knows a little bit of coding and wants to contribute to this system, we have something called a project Naomi, which is there on GitHub, right? So this is a open source project we are making for insulin algorithms. So you can check this out. Right now we have a very basic Python code for this, which was part of the the Centurion Insulin app. But of course, if you are interested, you can refine the app. We have actually already refined it to a lot of extent, so not put that up. But if you're interested, you can consider doing it, right? So just to conclude and give some take-home message, and the first fundamental take-home message is that when dealing with endocrinology in general and diabetes care in particular, we need to be precise because a lot of it is mathematics, not art, right? So it is very important that we dwell on the precision aspect of it. And insulin algorithm is a step in that direction, right? Algorithms in practical sense are used in insulin pumps already, right? And we can consider probably using this in the outpatient and also in inpatient ICU setting as well. And of course, we are coming up with newer coded developments for algorithms in various aspects of insulin management, including ICU, hospitalized. We'll try to make this into programs or codes which you can use. So keep watching this space. So thank you for a patient listening. And if you're more interested in some of these things which we have been developing, we have some books on this, right? We're also coming up with a book on insulin algorithm itself, right? On the mathematics of insulin, right? It's a dream project for me, right? So you can all consider. We have the best of notes in endocrinology. We have volume 1 and volume 2. Volume 2 is the diabetes special. Volume 1 is as a combined endocrinology and diabetes. These are books are available on Amazon, so you can check them out, right? So thank you for a patient listening, and thank you for this.